Welcome, everybody, again for another podcast in our Ageless Living Talks. I am excited to be here today to talk about aesthetics. I personally have a lot of questions about this myself. This is going to take more of a format of a usual podcast where I'll act more like a host, and then I have my guests of honor here that I'm very pleased to present with. And so as usual, am Jean-Paul Lim. I'm a medical doctor by training. I'm the medical director of Ageless Living, co-founder here. And again, I hope that you guys generally find these podcasts informative. So with me, I have the honor of presenting some guests that are part of the Ageless Living team. We have Jenna Pickett. Can you say hi, Jenna?
Hey.
So that's Jenna. She is a nurse. She started off as a medical esthetician, actually, for 8 years, doing advanced laser, skincare, facials, and she's a specialist in those areas. And then for the last 3 years, I think, you have been a nurse injector. And so she brings a background of both of those when she approaches the skin. And I think it's very unique and great. And we're very happy to have her. She's out of our Kelowna location.
Thank you.
And so then we have Shahima. You can say hi.
Hello.
So this is Shahima. And so she is a registered nurse. She's been a registered nurse for 26 years. Don't look it. And she's been a faculty member as well for the nurses program at a college for the last 22 years. And she's been an aesthetic injector for the last 7 years.
Correct.
Right. And so she's out of our Langley location, and I'm very happy to share this podcast with the two of you today.
Thank you.
So some of the questions that I know that I had when I was, when I'm thinking about aesthetics and how it relates to aging, which is where a lot of my interest lies, is how or what does it actually mean for you to age gracefully from your skin standpoint? And so I'll open this up to both Jenna and Shahima to add their thoughts.
Yeah, definitely. Um, I think that it means working on all layers of the skin and all layers of aging in order to age gracefully and the most natural, and also looking at aging, how you're aging on the inside and on the outside as well. I'm sure, Shima, you can add a little bit onto that.
Well, I just celebrated my 55th birthday last
for you.
weekend. And I have to say, the course of years, being in my 20s, 30s, 40s, and now 50s, your skin changes, right? And it changes according to many factors. And we need to be mindful of that so that we age well. I think the definition of graceful can be different for different people, but ultimately is how well do you feel? And that means nourishing your inside, caring for your inside, caring for your, whatever imbalances you may be experiencing, whether it's health challenges, hormone imbalance, environmental factors, and then nourishing your body to age well and feel well.
Yeah, and I love that you guys mentioned that and touched on that, that it's so important, even though the skin is just something that we see, it's often a reflection of what's going on inside. And not just inside like your organs and your body and your hormones, but I think also, as you mentioned, Shahima, your mental health, right? Like, I mean, all of this, I think, plays such a big role in skin health and how we look, and how our skin can age gracefully, right? I mean, I usually give this example to patients or to people that I talk to actually about how important hormones are to skin. right? And so, when you look at a pregnant woman, and it's often very well known or well talked about, they have a sense of glow to them, right? Especially women that are happy to be pregnant, they just have this glow on their face.
I don't remember that glow, but yeah.
And so I think that it just goes to show that I think there is a significant role in hormones and how it plays in your skin health and how you look, right? And also I think in mood, right?
I think where I experienced a huge impact in the change of my skin was in my 30s. And, I was in my master's program and full-time school, 2 kids. And I had significant hormonal acne-induced and my skin suffered greatly.
Interesting.
And it was related to probably a lot of the stress hormone changes, right? The cortisol levels being high, and I'm not alone in that. There's many women who experience acne at a later age, and that's when I found, after going through a lot of the over-the-counter medications that dried out your skin, and just not really understanding and not getting the right advice, having random facials and so forth. But then I got onto medical grade skincare. And it changed my life, because not only was I having acne that was uncontrolled, I also was hyperpigmenting, right? I have darker skin, and the hyperpigmentation just created this face that I felt really uncomfortable in. And once I went through a really well-tailored skin regimen, my skin changed within 3 months to 6 months. One of my colleagues said to me, he goes, "Hey, your skin looks like the backside of a baby," and that's how significant it was. And I feel like at 55, my skin looks better now than it did when it was 20.
Interesting.
So it really can make a huge difference, provided you seek really good advice. I think seeing an expert and understanding what is happening with you and all the different variables affecting you, I think can really change someone's way of being and feeling.
I think it's a good point. I mean, I think that you're already a nurse, right? So you sort of had some way or some knowledge of how to navigate through. No, you don't think so?
Not really.
Interesting.
People recommended retinol, so I took the prescription grade retinol, and I couldn't tolerate it. Right? It was too drying. It was too irritated. So it just made me like I felt I looked worse.
It's funny you say that, because I tried retinol when I was a teenager, and it was the exact same experience. It was so drying. And it was literally just like you two have said, I didn't even know where to turn. And so, what are your suggestions, Jenna? What do you recommend for people to do so that they don't, waft away in the wind?
Yeah, seeing someone who has a background in skincare and knowing how these ingredients work is definitely like the number one key to healing your skin, because there's so much out there on the internet and everyone contradicts each other, and there's new trends, and you kind of just have to stick to the basics. Even with retinol, like, you can learn these little tips from your esthetician to layer it and sandwich it in between your hyaluronic acid so that you're not getting those crazy dry periods. So yeah, I think just going somewhere with someone that you can trust, who's going to walk you through every step of the way.
And speak to me, you two, about medical grade versus standard retail products, because I know, especially for guys, we are a little bit skeptical, right? We just think okay, you're essentially charging me double or triple the price for something that I can get equivalent at, say, at a drugstore, right? I know that's the way that I think, because generally medical, you buy medical gloves and they're literally 10 times more expensive than non-medical gloves, right?
Sure.
Even though it's really the same product. And so are they the same?
In my opinion, no. um, the potency in medical grade skincare is so accurate and a lot stronger than what you can get at the drugstore. It's also a lot cleaner, so you're not paying for these filler ingredients that are gonna irritate the skin, fragrances that are just added for no reason. And there's a lot of science behind medical grade skincare as well. Drugstore skincare isn't backed by science, so do you really know what kind of results you're going to get with it? In my opinion, no.
Yeah, good one.
I think, I mean, I do have varying opinions. First, for someone who's in the prevention stage, who doesn't have a whole lot of complicating factors with their skin, I would say there is some good, reputable, over the counter skincare products. How much do they need, right? It really needs to be tailored to their skin type. In terms of looking at medical grade, for example, I needed the medical grade skincare, right? Not only does medical grade skincare warrant really well established research and clinical studies, it also each ingredient can be synergistic, right? Complement one another. So when choosing medical grade skincare, and your need for skincare goes up as as your skin becomes more complicated. I would say it would be better for someone to get good advice around what is needed for their skin and then move accordingly. Looking at vitamin C, for example, it's very expensive. Sometimes I look at my bottle and think, could I just squeeze an orange on my face? It would be great. But L-ascorbic acid is highly reactive, right? So it can oxidate and then it becomes inactive. Uh, Medical grade companies have put a lot of effort and ways of combining it so that it's stable, so that you get the benefits and the effect for a longer period of time. So there is a lot involved in how you choose medical grade. Does everyone need medical grade? No. But according to how your skin is and what your needs are, you should get the advice and expertise to tailor those skincare needs for you. And yes, you may need to spend a bit of money for it, but it can change your skin in a really, it's effective, right? In a really good
And
way.
it's a journey too. You don't have
Yeah.
to spend too much money and buy every single product that you need all at once either. You could
Yeah.
focus on the certain active ingredients, like you said, vitamin C, retinol, your sunscreen. Those are the most important. And then kind of build your skincare routine from there too.
Mhm.
Sort of like building a foundation and then slowly building
Exactly.
upon it.
Yeah.
Exactly. Yeah.
Yeah. So what I'm hearing here, I think, is to give people an analogy that I know that I find useful, is like we're not discounting. You two are not discounting the effectiveness of over the counter or retail skincare. It's
Mm-hmm.
just that it's not. There's going to be some people that's going to be enough,
Mm-hmm.
and then there's going to be some people that need more. Same as I guess with painkillers, right? There are sometimes that over-the-counter Tylenol or over-the-counter acetaminophen or ibuprofen or Motrin, whatever you want to call it, right,
Mm-hmm.
is enough.
Mm-hmm.
But sometimes your pain is too much and you need a prescription,
Exactly.
right?
Exactly.
It doesn't
Yeah.
mean that the over-the-counter stuff weren't useful. It just means that for some people with the proper guidance, like you guys said, you should get proper guidance like you would normally go to a doctor to get prescribed these stronger painkillers, you're saying that you need to go to a skin specialist, like the two of you, to be able to say, okay, well, what does my skin need? Is it just retail stuff, or do I need medical grade stuff?
Exactly.
Yeah,
Yep.
yeah. And then on top of that, like, is there more going on? You know what I mean? Like
Exactly.
I know,
Yeah.
I know from my standpoint, again, if I could bring a little bit of the medical part into this, is like, if someone's underlying acne, for instance, is being driven by PCOS or hormonal imbalance, I mean, yes, skincare regimen can help. Of course, it can still help.
And that's not the only thing I got,
Right.
right? When I was going through that, I also had oral medications.
Right.
I had oral medications, I had skincare, and I also had like dermabrasion for exfoliation, glycolic peels. Like my skin literally went from a highly pigmented, if lack of a better word, pizza face, to a baby's bottom. Like that's how clear it went. So I stuck to the regime. Do I need to do all of those things? Did I need to do all of those things for an extended period of time? No, I didn't. But once I started to get to the root of the matter, which was the key, I eventually was able to come to a different type of a skincare routine, right? Where I could maintain my skin health. So it's really important to be able to get the advice and then move through that journey, and things will change, right? Your skin is dynamic. You're going to need different things at different times of your life. But I think what I really, really want to highlight is sunscreen,
Yeah.
right? There was a study that surprisingly was in the States, and they had participants from Florida and across the States and Washington, right? And they found that the people living in the Northwest, the rate of skin cancer was higher, surprisingly. Why? Because there's an assumption that you wear sunscreen when it's sunny. When it's hot and sunny, people will put sunscreen on. When it's
That's me.
cloudy and overcast, they're not putting their sunscreen on. And what we know is that the UVA ray, which is predominantly when it's hot and sunny, is damaging, of course. But the more damaging ray, the UVB ray, which is pretty much across all daylight, right? Whether there's an overcast, rain, it's there. And we're not protecting ourselves from that. So if there's anything I can tell people, wear your sunscreen. Find the right one for you. There's so many different types that can be the right one for you. And once you get adjusted to that and incorporate that into your skin health routine, I think that'll be your long-standing progress. Yeah.
I agree.
It's funny that you say that, because I am literally guilty of that.
Yeah.
Like, I know when I go visit sunny places, that sunscreen is like top of my list, right? I gotta put sunscreen on. I hate going to LA. I hate going to Hawaii because I gotta put sunscreen on every day. But
You don't have the right sunscreen.
but then I'm like, okay, then I go to Vancouver, and even if it's a little bit sunny, I'm like, I don't need sunscreen. I'm in Vancouver.
No.
I know, right? And so my skin's gonna be terrible. But that's a very, very good advice and good, just general foundational information. And so I know we've talked about a little bit about acne and a little about sort of aging gracefully. Now, what about so we talked about what about other treatment modalities to help, I guess, both with acne or with aging gracefully? Like, do you guys know or have any advice on, things like red light mask, right? Like, what's the utility of a red light mask? Or even something further, like, are facials bad for you? Is getting regular facials going to dry out your skin, or is it going to be opposite, like it's going to hydrate your skin? Or is there any role in those kinds of things in maintaining, your skin health and helping you look younger and more vibrant?
Yeah, in terms of acne, I think it depends at what stage the acne is and also what type of acne. If it's very active, sticking to chemical peels, I think that's going to spread the bacteria. Like you said, the LED masks, the blue light is great for killing bacteria. Um, and then if it's, a little bit more so that you're dealing with the scarring post acne or like Shahima said, pigmentation post acne, then maybe you're looking at something like broadband light, like laser treatments. You can do microneedling for scarring. That's a great one. And then also, you're looking at what age your patient is too, because if you have someone younger, you're probably going to use things that are a little bit more delicate, like regular microneedling. Whereas if you have a little bit older patient, maybe you're looking at radio frequency microneedling. So I think there's a lot of factors in what treatment you're choosing for what specific concern.
For sure.
When we're just as we're talking about this, I mean, I just can't help but wish that this was information that I had growing up. I mean, I had terrible skin, and I would go to a not to diss anybody, but like a publicly funded like dermatologist who would prescribe me things like retinol, right? And then then my face blew up and I had terrible self-esteem, and it's terrible. I mean, the fact of the matter is that skin health is not just about vanity,
Mm-hmm.
right? And
Mm-hmm.
I know people sort of think about that, especially as we come later on to things like injectables. They just think it's about vanity. But I would argue that the skin has so much, because it's what people look at.
Mm-hmm.
It's the first thing people see, and unfortunately, regardless of what anybody says, it's how you're judged, right? Whether
That's
we
true.
whether
Yeah.
whether we like it or not, right? We're judged by it negatively or positively, right? And so it is important, I think,
Mm-hmm.
right?
Yeah.
As you age, you don't want to look like your face is aged. You want to look vibrant because people will look at you and make a judgment on you.
Well, also, I think the way your skin looks can reflect a level of health, right? So when people are struggling with skin issues, they often the radiance of their skin, the texture of their skin, the discoloration of their skin, all creates an image that perhaps there's something wrong with their health.
Mm.
I mean, there could be, deeper factors involved, but overall, it creates an image that, or reflects an image that perhaps that's not really that person.
Mm.
And what we see on the outside, and the skin being the largest organ, if it's functioning well and it's healing well, often it gives the impression that someone is healthy.
Yeah, it's a very good point that you just bring up there, right? I often have to remind myself that the skin really is the biggest organ, and
Mm-hmm.
often you will manifest or show how your body is inside,
Mm-hmm.
with your skin or through your skin,
True.
right? And so yeah, good reminder. Jenna, anything to add about that?
No, I think that was a good point you made.
Okay. And so let me ask you too. I mean, first question is for skin products.
Mm-hmm.
Okay, let's talk about what I consider like bare minimum, and then the nice to haves. Okay,
Mhm.
do you think that is it different for a man versus a woman? That's the first question. And then the second question is that is your foundation, we're just talking about bare minimum here, is your bare minimum foundation, or what comprises the foundation, different for someone who is in their 30s versus someone who's in their 50s? Okay,
Mm-hmm.
so two questions. Again, sex-based, gender-based,
Okay.
and then age-based, whether that changes. For just, again, bare foundation skin product recommendations.
So I think for someone who is, there's a few factors I just wanted to draw out. So looking at the chronological age may not necessarily reflect the biological stage or aging, right? So that's one thing. When we're looking at the skin, we're also assessing for their genetics, health challenges they may be experiencing, the environmental factors that have influenced the way their skin has performed or been damaged, for example, could in fact influence the choices of skincare. Right? So that's one thing. Once we get into more, and we know that after the age of 25, 26, the number of collagen and elastin cells are depleting. They're getting lower, and then it starts to accelerate in its depletion when we get to about 35 and moving forward. And now we have more complications with hormones and premenopause and menopause. So, but from a simple perspective, looking at someone at aging at a normal pace, I would say that basics of sunscreen, right? Protection, barrier. Looking at a retinol, and retinol, the key to retinol is consistency. And right now we have products that are time release. I just recently incorporated retinol into my skincare. Finally, I found something that is not irritating, and I'm comfortable with it. So now I use it, right? And that's the key. Do we need to have high doses? No. You know, what your skin can tolerate is the most important, and gradually knowing how to incorporate it and gradually increasing, that's another thing. And when you're looking at somebody in their 30s, it's a good time to start incorporating some of this. An antioxidant like a vitamin C, I think those are like the staples of what skincare could look like, and then adding as your skin changes or it needs more. When you get into the more perimenopause, menopause, postmenopause, the demand of what your skin needs in nourishing is higher. So yes, you will probably end up needing more in your skincare routine versus when you're 30. Did I answer that?
Yeah.
Yeah.
Okay. And then Jenna?
Yeah, I agree. I also do think that a cleanser is
Mm-hmm.
really important, especially if you're wearing makeup.
Mm-hmm.
And double cleansing. I think not a lot of people know that you should double cleanse if you're wearing makeup, because you want to first get off the makeup and then you want to do a second cleanse to actually remove more of the impurities from the skin. And then I think a moisturizer is really important as well, because if you're using retinols, you do need to hydrate the skin as well. And then your question about whether it's different for males and females, I would say the foundations are pretty similar. I would stick to those, and then sometimes you can get away with a little bit more aggressive for men because their skin is actually thicker and they do have more oil glands.
Okay. So
Mm-hmm.
uh, maybe a question that I should know the answer to. Um, what does retinol do, and why do you need it? Like, why is it?
Yeah.
Why is it form part of your foundation, Jenna?
Yeah, so it helps the skin cells turn over faster. So as we age, everything slows down, and so does your skin turnover. So to have healthy skin and new skin cells coming in, we have to use retinol to speed up that process.
Okay, and I know this may sound stupid. Like, does it increase your risk of cancer? Because it increases skin turnover or not?
Not that
No,
I
it
know of.
actually can
Okay.
decrease your risk
Yeah.
of
Okay.
cancer.
Okay.
Yeah.
Good. And so your retinol, you recommend, as you suggested, maybe at a lower dose when you're younger and then a higher dose when you're older. Does that sound about right?
Not necessarily.
Okay.
It's what your skin can tolerate.
Okay.
I think the key message is consistency.
Mm-hmm.
Finding a retinol and a dose, and you can try to increase it, but being at a place where your skin is tolerating it and you're using it on, almost a daily basis or 3-4 times a week, I think will be the ultimate results
Okay.
for you. Yeah.
Mm-hmm.
Okay.
Mm-hmm. Yeah, if you're a little bit oilier and dealing with acne, you might want to use a stronger retinol, like a 1%. But if you're on the drier side, your skin's more mature, you find that you get like creepy skin really easily, maybe just sticking to a 0.5 is enough for you. And you can try and work up to using it daily. But if that doesn't work for you, you can always just use it like 2 or 3 times a week and you're still going to get really good benefits from it.
Okay. And then another question about you, so Jenna, you mentioned double cleansing or a cleanser in general. Is
Hmm.
there any particular things about a cleanser that you look for? Like an
Yeah.
exfoliating, non-exfoliating?
Hmm. It
Uh,
can be person dependent too, whether someone likes a gel form or a foam consistency, or maybe they're a little drier, so they want a hydrating cleanser. So I think it just depends on how oily that person is or how dry they are, what their skin type is. Or even if they're dealing with acne, you probably want to use a cleanser that has some salicylic acid in it and then do a little scrub in the shower, leave it on for 5 minutes, let the salicylic dissolve those oils, and then you're kind of almost getting like an at home treatment from your cleanser as well.
Anything to add, Shima?
No, I would say just follow what your skin needs, right? Different people, different skin. There are so many different products with so many different ingredients. And the key is to find the right ingredient that works for you. Yeah.
So I think, without seeming to toot our own horn here, is that I think what I'm hearing is that there's not a product that everybody should be using. It should be tailored to people's needs, right?
Mm,
Oily versus dry versus, acne or not.
right.
And that you really should be looking to get advice from someone who knows skin rather than what I used to do, which is I just used to just see what was on the commercial or what my friends were using, and then I would just grab it from the drugstore, right? I mean, I think, and
Mm-hmm.
honestly, I think I represent kind of the usual layperson, right?
Yeah.
I agree. Yeah.
Yeah, right. I mean, we just walk down the aisle of the drugstore, and we're just like, I got acne. Let me just pick this one. This one worked last time, or this one didn't work last time. I'm just gonna use it, right?
Yeah, exactly.
Okay. So sometimes trial and error. I think even as experts, you guys still
Mm-hmm.
do trial and error, but more focused, I assume.
For sure.
So, due to the length of this podcast, we're going to split it up in two. Join us for our next episode, or the second part of the episode, which is going to talk about social media trends and Ozempic face, and also answer the questions submitted online. So, look forward to seeing you there.